Hi, have you heard of IVF? Do you know what it really means? Are you trying to consider it as one of the options um, to be fertile? Is that what you're trying to do? Well, do not worry, you are in the right space at the right time. In today's video, I'll be walking you through IVF, what it means, who can undergo this procedure, what the procedure actually entails, the cost, the side effects, and the risk that is involved in IVF. Let's dive into the topic now. As you pay attention to the image here, you can see that IVF is one of the most effective and common types of assisted reproductive technology. Now, what do we mean by the IVF in general? So it's a matter of taking the male sperm and then the female egg. We bring them together. If we are in the lab, we call it in a petri dish or in a glass, and then we make sure that the outcome is an embryo. Now, this embryo is then inseminated, okay? From outside, we have a fertilized ovum, or we call the embryo. Now, this embryo is what we are going to inseminate into the female uterus. And in the uterus, it means we have skipped all the fertilization mechanisms, and then we are going straight to inseminate what we actually need to form the baby. I hope this makes a little bit of sense. Right, since it's one of the most common and effective methods of assisted technology, so there are certain people who might actually benefit from this assisted technology, and I'll be walking you through some of these people. So bear in mind, the first point is if you've been trying with your partner, you've been trying and it's not working out, okay? Whatever you do, it seems like you've gone to see your obstetrics and gynecologist. They keep on telling you that there is no actual cause. In this sense, or in this case, I think you can benefit from an IVF. This is when you try to just like the procedure I mentioned earlier, you try to get your eggs outside, and then the male also gets a sperm outside, and then it is processed to form the embryo, and then we can get some good results out from that. Also, if you are someone who have been told that your tubes are blocked, especially, or there are no tubes even, especially people who have experienced something like pelvic inflammatory disease, ectopic pregnancy, whereby the tubes are not actually functioning. Okay, the tubes are not functioning. It means they have done maybe a hysteroscopy, that an imaging or a camera has been sent all the way from the vagina to the uterus, and then viewed the tubes, and then still the tubes are not working. In this case, you should know that you can actually opt for an IVF. Okay, also in people with ovarian problems, people who are not actually let's say ovulating, they are not seeing their menses, people with cases like primary ovarian failure, um, polycystic ovarian failure, endometriosis, all these cases, you can actually opt also for IVF. Also, if you're a male with low sperm count, that is one, and then low motility, or the movement of the sperm is not actually good. In this case, we have to cultivate or culture the sperm outside and then also get the egg outside. You'd realize that you've been trying, but they keep on telling you that, or your doctors keep on telling you that it's not working, it's not working, it's not working. In this instance, you need to try and opt for IVF. Also, people receiving cancer treatment. Sometimes there are people who want to preserve their eggs. Let's say if it's a male or if it's a female, they want to preserve their sperm. Okay, you can also opt for an IVF, because you might be you might take the sample, or you might take the egg and sperm and then keep it in a refrigerator or in the bank. Yeah, let me use the perfect term. You keep it in the bank, awaiting the right course of action. maybe after the cancer treatment, you just go on and then you get your product, okay, for childbirth. So these are some of the few instances where people sometimes um, IVF actually benefits people like that. Also, there are people with same-sex couples, like male, male, female, female. So in this instance, you can get that of a male or a female, and then the procedure is done. One party carries the pregnancy, or it is inseminated into one party, and then pregnancy is achieved. So it can be done in several ways. So with IVF, it actually engulfs or involves some few steps, and that steps I'm going to take you through it. Now you can be looking at this whilst trying not to look at me. All right. Okay. So yeah. So look at this image, and then I'll walk you through the steps one after the other. So point number one is where we have the ovarian stimulation. Now there are several people, or in all the cases I mentioned earlier, you could tell that there is a problem with ovulation. Okay, that is actually what is leading to the infertility. So in this first step, we are going to make sure we make your egg. Let's say we are including the man as well. We are going to make sure we make the egg and the sperm quality. All right, we are going to make it quality. And um, the first point, the ovarian stimulation, we are going to increase the amount, or we are going to increase your ovulation, okay, such that when it is time for us to go pick the eggs, we will actually get something to pick. Or else, if there is nothing to pick, it means we are going to fertilize just a sperm without an egg. There can't be any fertilization. Okay, so the first point is where we are going to activate or stimulate the ovulation process. Now, the step number two is the egg retrieval. If you look there, you realize that we are using a probe, okay, a tiny probe, to go all the way into the ovaries where the eggs are. And then we are going to take a bit of it and then bring it out. We are going to take some of the eggs and then we bring it out through this tiny tube, okay, through the tube, and then we store it in this sample bottle, okay, in the sample bottle. Now, we also need the sperm. So what are we going to do? Do you remember that when you are trying to actually mate, and then the man comes, we can actually collect it? Exactly. You know the point. So we are going to collect his semen as well when he's CUMM. I know when I say when he's coming, please don't think of CO. No, I mean when he's coming, yes, you are going to collect the sample. If you go to your obs and gynae doctor, they are going to walk you through these steps. Take a sample bottle and then you collect it, send it to the hospital, or sometimes it can even be done in the hospital. Okay, so we take his as well, and then you can look at the step number four, which is egg fertilization. This is the point where we have collected the sperm, we have collected the egg as well, and then we need to, fertilization is that fusion. Okay, we need to bring both together. So that's the glass or a petri dish in the lab where we are going to release them into it. Now, this fertilization process takes within an hour. Fertilization is ongoing already, you know. The egg stays at one place and then the sperm tend to move towards it. So if this is a man whose semen is not, the motility of the semen is actually not effective, or is very low, or low sperm count. Now we've brought the egg and the sperm very, very close together, and they are in the same pot. So at this point, you don't need to move too much. All right, you don't need to move too much in order to, okay. So at this point, there is fertilization ongoing. Within 1 hour, something is actually happening, right? And then the embryo is going to develop. That is when we go to the step five. That's the very, very important part. The embryo is going to develop, and through that process, there is going to be division. Okay, the division is the most important thing. If it doesn't divide, we can't proceed. If it doesn't divide, we can't proceed. So it has to divide until we get those eight. As you can see in the image there, is giving us 1, 2, 3, 4, 5, 6, 7, 8. So we are going to get this 8. Now, the sixth step, okay, all these processes are going on within an hour. Okay, now with the sixth step, we are going to inoculate. Okay, we are going to take some of the fertilized ovum, and then we are going to inseminate it, or we are going to pass it through all the way. This, for your information, is a painless act. Okay, it's a painless procedure. You are going to take it and then push all the way into the uterus. So if you look at the picture over there, you can see that the needle, the syringe, is going all the way into the uterus, and in the uterus we are going to release it over there. Now, the process that happens over there, I'm going to come back and then take you through. But when it's in there, we give ourselves about 14 days to 16. I mean, we have about 2 weeks, and then we are going to get the seventh step, where we are all waiting for. The man is waiting for, the woman is waiting for, because we need a baby. All right. So the seventh step, at that point, we are going to get ourselves a test kit, and the fingers are crossed like this whilst we wait for the two red lines. That happiness and joy will be in the home. Okay, so now let me walk you through this. What is the actual success rate of IVF? If you are below the age of 35, we say that you have the success rate is actually between 40 to 50% per cycle. Okay, per like one cycle of IVF, the success rate is around 40 to 50%. And if it's actually decreases when you are 40 years and above, it's about 10 to 20% per cycle, which means that you might need multiple IVFs or multiple cycles in order to achieve the right full goals. But this is the catch. Now, to attain the success rate, it means the actual cause of the infertility should be understood, or we need to know the actual cause of the infertility. If the cause of the infertility, the embryo, the quality of the embryo, the lifestyle that you are living, it's all part. Your BMI, that's the body mass index, I mean the weight. Okay, smoking, the alcohol, the exposure to toxins, exposure to different fumes, gases, etc. These are all part of the things that actually leads to the success rate. Before I even move on to the risk and the side effects, don't forget to subscribe to this channel if you are enjoying our discussion today. And like, if you have any comment, you can drop it in the comment section. Yes, let's go on. Now, there are certain things that come up as a means of risk factors and also side effects. Wait, before everything, you are thinking about this whole procedure. You're thinking, should I go and do this? And it keeps on bringing certain emotional stress on you. Please, if you are going through any emotional stress as well, I have another video here. Go check it out, and then you are going to enjoy what I mean by emotional stress as well. Okay, so emotional stress, if you are going through them, get assistance and make sure you are feeling better before you undergo this. Also, there's going to be something we call ovarian hyperstimulation syndrome. This is OHSS. Now, in this step, do you remember the first point we made? Ovarian stimulation. Now, through this step, there may be medications you are taking in order to boost the eggs to, be quality or be abundant. And in this step, if you are not careful, you are going to have excessive production of the ovaries or the egg. Okay, so you need to be very careful. That's why you need your medical doctor to walk you through every step of the way. Sometimes, I know you've heard this, I know you've heard multiple pregnancies. There are people who, after doing an IVF, they tend to get, let's say, multiple pregnancies, like 3 children or 3 babies at a time, 2 at a time, twins, and etc. Right? Yes, so it's also one of the things. Probably you are just expecting one child and then all of a sudden three. Take it in good faith. All right, I'm just joking. Yeah, so the other point is also ectopic pregnancy. So after we have released or we've inseminated the embryo into the uterus, it might want to find its way anywhere at all, even through the tubes. And this may, or it may fall anywhere, and this may lead to um, what we call ectopic pregnancy. So these are some of the risk and the side effects that may occur when you are going for an IVF. Before you even beat me on why are you talking, we need to know the price, the cost, the blah 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 blah. Hold on. So you know that doctors are not too good when it comes to, I mean, financial issues and stuff like that. I'm not saying doctors are not good with finance. No, listen carefully. When it comes to, like, you get to the hospital, you want to know how much does this cost. The doctor is like, I don't know. And it's true, we don't know. We know nothing about the pricing and etc. But I've made some research. So hold on, let me tell you. So IVF is a bit expensive, but depends on what you are actually going in for. All right, as in, you know why you want to have a baby, you know you want to give in your best, you want to be a mother, you want to be a father, maybe pressure from, I mean, different things come together to actually make someone risk why they want to put in a lot of money into IVF. Now, IVF is a bit expensive and it comes with different forms of things, and so you need to pay attention to this one. I have a breakdown here. So in the US, for example, all right, they said a single IVF cycle can cost about 12,000 to 20,000 or even more. Okay, and then the medications add to be about 3,000 to 5,000 dollars, please. Dollars. Yes. So it's a bit, let's say if you have 30,000, you should be able to get medications. You should be able to get a single cycle of the IVF. Maybe it's different. Maybe it's a little bit less. I know people travel to different countries or jurisdictions to get these done, and the price or the cost is a bit lesser over there. There are certain insurance coverage as well, which also varies. Okay, some plans cover it, others don't even look at IVF and etc. Some countries like UK or Canada may offer partial or full coverage under public healthcare system. I know in the UK there's a bit of, I mean, there's some form of coverage in it, but in other countries I can't really tell. So IVF can be a little bit expensive. I won't say it's expensive because you don't know someone's pocket. Look, there are people with fat checks. Yeah. So if you have a fat check and you want to get IVF, I mean, you can you can go ahead. It's one of the recommended um, assisted modes of all technologies. You can go for it. So it's because it involves things like the services that is ongoing, the genetic um, testings, the donor sperm, the eggs, I mean, the whole process is quite a lot. So they need a lot of resources in doing the IVF, and that is why it's one of the means, or it's quite expensive, right? This is the happy side of this whole teaching, and I asked you to stay back and keep watching. Okay, so I have a video here which is going to teach you about how to make sure your sperm, your egg are all in good shape, the foods you need to eat in order to help you attain the right outcome. Now, before I move on, I want you to understand that IVF is not the only option. So if it's not the only option, then what is the other options? Okay, what are the other options? So one, we have the intrauterine insemination, okay, which we take the sperm. Okay, you don't need to bring the egg out. We take the sperm and then we send it all the way up, because most probably the man is not, there it's not right, okay? It's not there yet, and so we need to send it to the egg. You know, the egg will always stay there and wait for us to approach them. It's the same thing that happens in life. Exactly. Okay, the other one is the egg or sperm donor method. Okay, you can also do that kind of method. There is also adoption. This one of the very, very good options. You can adopt. You can also do surrogacy, which are actually things, methods that are there if you want to be called a mother or a father or etc. I mean, you have your own reason why you want to do it. So these are some of the other steps. So IVF is a very complex and emotional procedure, but this has also brought a lot of hope, smiles, laughter to homes, families, and people have tend to increase their family sizes across the globe. And this is not just in one country, it is across the globe. If you find this video educative and you loved it and you have any form of comment or questions you want to drop down there, you can do that in the comment section. You can also share this video to someone who might actually also need it. Kindly subscribe to the channel and let us know if you need more content like this.